Hello, everybody. How you guys doing today? We finally made it. We're at the end of the month of May for Stroke Awareness Month. I've come up with a bunch of different episodes for stroke awareness and also the different type of things that comes on with hemorrhagic strokes or any type of bleeds or just strokes in general and the disabilities of that. And the show is called Connecting the Dots. So what I have done is I made up 8 episodes. This is the final episode. I got caregivers, stroke survivors, people that had brain trauma, and medical people talking to each other about how we can actually figure out what we need to do as a survivor outside of their care. So today I have 2 great people that has graciously came and give up some of their time and come onto this show. First, I'll introduce our caregiver. She's out of California. Her name is Michele Young. Michele, how are you doing today?
Hi, I'm great, Greg. Thank you so much for having me and let me participate.
No doubt, no doubt. I'm always glad to talk with you. You're such a great person. I have what's called a caregiver basket, and each and every month I give out these caregiver basket to caregivers. And Michele is gracious enough to make this little journal that actually goes a part of it. So I really appreciate you for actually taking up with my cause. I really appreciate you. Now let's go to the medical side. We have Kathie Kurtz. Am I correct?
Yes.
She is a case manager here in the same state, the same city as me, Atlanta, Georgia. How you doing, Kathie?
I am fine. Thank you for having me.
All right, so let's get started with today's show. Kathie, I got to tell you, for me, case managers wasn't the best thing for me as a stroke survivor. When I was in the hospital in Louisville, Kentucky, I had a case manager that was working my case, but I was at odds with her because she was telling me one thing and then telling my wife another thing. And my wife was all the way in Atlanta and I was there in Kentucky all by myself. That's neither here or there. But why don't you tell us what the role of a case manager or case worker is supposed to be for a person with some type of disability?
Well, the case manager really serves as the point of contact in my mind for the patient and the family. So a lot of times the patient has the therapist that they're working with directly and the physician, whereas the family is a little bit more removed from that. So a good majority of my time tends to be more with the caregivers. But for both, regardless of caregiver or, the client, we want to make sure that as a case manager, we have a very good understanding of what the goals are when the person finishes therapy and they're at home, what is going to be the most important to them. And we use that information to guide the team toward what is important to the client. Because, the therapists are all going to have their goals. They're going to assess you, they're going to have your goals. We need to make sure as a case manager they're communicated to you and they're meaningful for you. So there's a lot of leadership there. Then the other part of what we do is look at what resources are available in the client's home community where they're going to be living. And that's something you want to start from day one. Where are you going? Who's going to be there? What support are you going to need to make that work?
Okay, so with that being said, I'm very appreciative of you because I didn't know that second part. When I was in the hospital, everything was taken care of at that particular point with the case manager, understanding what therapy I'm supposed to have and how long I'm supposed to be there and communicating how my progress was with my family. But getting that information about how I'm supposed to be when I'm home, I didn't get any of that stuff. So I do have a question before I even bring Michele in. For a person like myself or anybody else that's out there that's been out of the hospital a year, 2 years, are your services still available for a person like us?
My services are, yes. So, there's a continuum of care people have in emergency situation that brings them to typically an emergency room, and then you transfer to acute care hospital here in Atlanta. You might start at Grady or Atlanta Medical, and then hopefully get transferred to Shepherd Center where you're in the hospital. From there, you go into day program or outpatient, maybe both, and that's my program, and that's called post acute. And I'm sure, as you know, um, people will come to our outpatient post-acute program right out of the hospital, and we work as much as we can to help them get better. Are you still able to hear me?
Yes, yes, you're good.
Okay, okay. Um, and their needs change. So I'm getting to your question. Um, so we might see somebody when they're still within that first year of their recovery, and we're able to do as much as we can to help them get as independent as they can. And you being a survivor, you know that within that first year, your strength, your endurance, and just living life it's not at the final end. That is something that continues to progress. So when somebody leaves our program, we do a discharge plan that includes home programs. So these are the things we want you to work on at home. And then we tell you when you're starting to do A, B, C, whatever that is, then it's time for you to come back. And within that time, you're also followed by one of our physicians who can easily refer you back to our program. So for me, with what I do, it's not uncommon that I see people who are 10 years post because they change. How you look when you're 1 year post injury is very different from how you're going to look at 2 years or 10 years.
Absolutely, absolutely.
Right.
So Michele, let me ask you, you dealing with a adolescent that had this type of issue, and I can imagine just being an adolescent that she's going through so many different changes. Do you have a case manager that you work with, or are you all on your own?
We had a case manager when she was at a rehabilitation center, and they provided, like DMEs, the equipment that you use at home, like a walker or a shower chair, that kind of stuff, and helped us as far as, I guess, like setting up all the physical therapy outpatient and those kind of things. But that was like the extent of it. And basically, we just see our, neurologist and therapists, physical therapy and things like that. And I guess that's my question is like, I thought that was it,
Me too.
that was all. And she was 14 when she had a rupture, and she's coming up on 3 years. She just turned 17. And like you said, and as your guest said, things change. And especially with her age coming into adulthood and me kind of passing the reins as her, I'll always be her advocate, but just having her be responsible for her own care and knowing what to do and who to talk to. I wish I had a case manager, because I always felt like a case manager kind of is the umbrella holder of all the different components of
Icky.
people who help you.
Okay. So yeah, Kathie, when you hear this, like, does this dishearten you? Like what can be done for people like us to find these different avenues for case managers? Because a lot of us out here are lost. We're really lost. For
Yeah.
instance, I didn't have anybody to help me. I left my home. I didn't have anybody. It was just me trying to get back on my feet. I didn't know where to go to. I didn't know right from left. I just stumbled onto some things here, stumbled onto some things there. But I can imagine there's a lot of people out there that don't know what they're doing. What can we do for them?
Yeah, that's unfortunate. So, and it really depends on what your resources are. Here in Atlanta, we're good. We have Shepherd Center. So, for clarification, when somebody leaves Pathways, I make sure they have that discharge plan, but then I don't continue to follow them. But if they need me, then they call me. And I mean, I have people. I've been at Shepherd for 20 years, and I've been doing brain injury for 30. So I mean, I have people that I've been talking to for years and years. But you're continued to be followed by a physician, and so our physicians can refer to case management. So I guess not knowing other facilities and certainly not knowing California and other states, I would start with a physician to see if they have a case manager at their facility that could help with resources. Another resource would be to look at what brain injury association you have in your area, because usually most states have a very, very long listing of resources available and people very familiar with those resources that could also direct you. So I don't know if that helps, but
That does help. That's a great help, because like honestly, like I was saying before, I didn't have insurance. I had to wait till disability kicked in 2 years for Social Security disability. I didn't have insurance. I didn't have anything. I didn't know where to go. I didn't know where to turn to. I would go down to the Medicaid office and they just turned me away. I went to
yeah,
Social Security. They turned me away. No, I didn't know where to go. I didn't even know about you guys as shepherds. I didn't know about that. None of this
yeah,
information was actually available to me at my present state. So when you're saying this, I really appreciate it, because that does help out a lot. What about you, Michele? Does that help you out?
Absolutely. I will definitely be giving the doctor a call and requesting a case manager. Pardon me, a case manager. Here in California, we have a large entity. I don't know if they have it out in Atlanta, but I'm a Kaiser Permanente patient, and so is my daughter. And so it's a very large insurance slash hospital, pardon me, group that has many, many resources. But like you said, if you don't know where to start and you go down certain paths and then you kind of hit, blocks, you just feel like, okay, well, then maybe it's not available or maybe it doesn't exist. So that's why I'm super thankful to be able to speak today about this, because like you said, you're not alone and there's many people out there trying to find their way. And it would be great if there was a more clear path to find these resources, because resources can make a huge difference in people's lives.
Absolutely. Absolutely.
yeah. And I would just add that, since you're in the Kaiser system, it might be, well, your physician then is with Kaiser, correct?
Yes.
Yeah. So he would have, in my mind, maybe not in his, but in my mind, he would have case management resources for you.
Okay.
And, then the question's going to be for them. You don't really need Kaiser resources. You need community resources. How do, you had specific questions. Um, and then just another thought about that specific to you, Michele. I would also have a conversation with your physician that your daughter is getting ready to embark on a whole new life. Everything is going to be changing for her. And it would be worth it, in my mind, if she had a neuropsych evaluation, if you're concerned about any cognitive pieces or language impairments, in occupational physical therapy and speech therapy evaluations to make sure she's ready for her next journey. And so it kind of goes back to, again, going to the physician and advocating for what your needs are, because ultimately they need to do those referrals.
Great. Thank you.
So, Kathie, I'm gonna switch gears a little bit. Let's talk outside of the medical realm. Let's talk about how a person like Michele's daughter, like we just talked about, she's transitioning to become an adult. She's going to college, or she might go to college. What things are out there to help her out to be on her own, to live on her own, things of that nature. Is there any kind of assistance out there for people like that?
There is, and it's driven state by state. And, of course, I am the most familiar with Georgia. So it would really take some, Googling to find these departments. But here in Georgia and in Illinois, they have Center for Independent Living. And that is a government program, a state program. And they should have resources about how you could tap into independent living skills training. If a person has insurance, I feel they're always going to be better off going that route,
Yeah.
but you could, in addition to that, look at Center for Independent Living, see what resources they have. You also want to look at your Department of Rehabilitation Services, and that's each each state has their own locations, but it's, as far as I know, federally funded. And they have a lot of resources, including assistance with tuition, assistance with tutors, things like that for somebody going back to school. So
Really?
yes, their job is to get people ready to go to work. So when you refer yourself to Department of Rehab Services, or it might be called Department of Vocational Rehabilitation Services, they will do an interview to see if you qualify. They will do their evaluation and they will determine if you have vocational potential. I cannot imagine they would not think somebody, a 17-year-old would not have that potential, or even somebody like you, Greg. So they then put together a plan about what they're going to do to make you employable. And for somebody who is college age and their goal is to go back to school, then that is what I would pursue with them, that this education is going to allow them to be employable.
Michele, what's your thoughts?
I think that's great, because that's kind of exactly where we're at right now. And
Yeah.
I do want to find out from somebody other than me trying to figure it out, is she employable? She suffers from really debilitating chronic pain, and she takes medication. We're trying all different kind of routes to help her with that. But there's some days where it's so bad, I feel like, how would she ever work? How would an employer be willing to be so patient with her needs? And I know that, there's ADA laws, with the American Disabilities Act, that have to provide, modifications to jobs and things like that. And I wonder, is that available to her? How do we get more information regarding that? For example, she's trying to get a summer job, and this is her first job, and she's questioning, hey, if I work 8 hours, does that mean I have to stand for 8 hours? And I don't know if I can do that. And so a part of me is like, yeah, but there's modifications, and they should be able to provide you with a chair if you need it. So then I wonder, like, do you disclose to the employer? And it just kind of leads to other questions. And I wonder the best route and how to accomplish that. And yeah, summer job, you get it, you don't get it, it's okay. But like a career, something to make a livable wage that you can live and be on your own and be independent. That sounds great. I mean, I'm going to look for a vocational rehab center, I guess, or department, I should say. So,
Right.
oh,
Yeah. And it would be through your state, and they explore all of that. That's, I mean, what you're saying to me, that would, like, if she were in my program, I would be doing a referral to a vocational counselor, because that's what they do. They explore all that.
So Kathie,
great.
I'm sorry, go ahead, Michele.
No, I'm just so thankful to get any little nuggets of info.
So
And
Kathie,
then,
go ahead, Kathie.
oh, just one question. Sorry, you're doing a great job there, Greg. Just one more question. I know that, and I hope I'm not asking anything private. I mean, don't disclose what you don't want to, but are we just looking for you, specifically for your daughter, at physical, like spinal cord issues and pain, or is there a brain injury or cognitive component to that as well?
No, it's completely physical, and completely about pain. I mean, she has mobility. She's lucky in that she was able to gain function and learn to walk again, but her stamina is just very little, and she still suffers from quite a bit of pain, and it's like unpredictable pain. It's not like I overdid it. Sometimes it's I overdid it and I'm in pain. And sometimes it's just I woke up and it's not a good day and I'm in pain.
So, and I'll be very brief.
Oh, go
So
ahead.
for you, you might look at spinal cord injury associations, whereas before I had mentioned brain injury association. So you might want to look more towards spinal cord injury association networks, just because they might have more information about the physical component of it. And then for the pain piece, I mean, obviously, you know, that needs to be managed. But I know and I know it's a challenge. I mean, you've been dealing with that for 3 years, but I know we have a comprehensive pain clinic, and a part of what they do is work with a pain psychologist. So I just don't know if you'd considered that, because they teach them different ways to manage. Because at some point, that's something needs to happen. I mean, your daughter's so young, you know, that something's got to happen to empower her to be, you know, for her to be able to get through her days. So just wanted to add that.
So Kathie, I'm at this point right now that the information you're giving to us is very good, but we can't find this information. So I'm very curious. And if you know, if you don't know, that's fine. Are there like people that do things like this pro bono so we can actually find an avenue to go to? And I'm compounding with this question with, you know, a lot of these state agencies that you go to, a lot of them are not just necessary for brain people, or they could be for people that have mental illness or drug abuse, and that's who you're dealing with. And for me, I went to one of them in New York, and I felt like I was going to throw up. It wasn't for me. It was repulsive. So I felt like they degraded me, putting me in this type of situation when I don't think I should have been there. So thoughts?
So a couple of thoughts. Yes, to answer your question, you know, first acknowledge that right now, especially during the pandemic, I think all of the state and federal agencies are just swamped at
Yeah.
minimal staff capacity. And you're going to, you know, with any business, whether it's government or non-government, you're going to have some that are better than others. And sometimes it can really feel like it's just hit or miss.
You're right.
And, you know, resources, you know, that's a good question. Here in Georgia, yes. Outside of Georgia, I don't know. But in the state of Georgia, we have the Georgia RSVP clinic. And the Georgia RSVP clinic is for people who don't have any funding or have inadequate funding. So in the state of Georgia, Medicaid is not considered adequate funding.
Yeah, we know.
Right. And so that person would be appropriate for that Georgia RSVP clinic, which I also volunteer at. Shelby volunteers at it. There's several of us that volunteer there.
Really?
Yeah. Now, if somebody has a funding source, which would be Medicare or private insurance, they can get physician orders for therapy and go into a program, you know. They wouldn't have to necessarily go to any of these free clinics.
They're terrible. I hate them.
Yeah, I mean, you know, I have some people that ooh, it's getting windy. I have some people that they've done a really good job with. But I mean, you're right, it's hit or miss. And
Right.
you know, some programs have their own vocational counselor, but the problem you have is insurance doesn't fund it. They don't
Yes.
fund folks. So, you know, I don't have that problem. But for people that are under 18, I would look at children's hospitals to see what resources they have. You know, here at, if you were at Shepherd, if you were a Shepherd patient, we offer vocational services at no charge. And, you know, there's St. Jude's in Memphis, and they have different services that they offer at no charge as well. And so I would look at children's services if you're under 18, and then over 18, you know, here it's going to be Grady if you have no insurance.
So, and Michele, I'm not really trying to talk for you, but I think this is probably one of your questions as well, because it's one of mine. Kathie, what about like housing? Like I get Social Security right now, and that barely gets me to what I need to have for my housing. But as we all know, the economy is changing, and sooner or later, I'm probably not going to be able to afford a place to live. I try to go to different sites that are actually supposed to be for senior citizens, but they don't usually take people under the age of 60. So for myself and for Michelle's daughters, they want to get their own place and things like that. Are there places for people like us that can actually help us get a place to stay at a reasonable price for, I guess, disabled people?
Right. So, I wish there were more. A lot of times, programs that, I would start with looking at the Department of Housing Authority, wherever it is you live. And so for here, you would be looking at HUD housing, which isn't necessarily safe. You have to do a lot of research, and it takes a
Yeah.
lot of time. Takes a lot of time to get a HUD application approved. So, I would start the process knowing it's going to be a long time before you hear anything. If you come across any resources that provide housing assistance for senior citizens, they may have a clause that states, or you have a disability, a permanent disability. Because a lot of times I can get my people into such programs, not for housing. Housing's tough, but Meals on Wheels, different things because they have a disability. But housing is a need, I think, everywhere. And yeah, I wish we could do more with that.
Michelle, go ahead, Michelle.
I have a question. Is HUD the same as Section 8?
Yeah. Yes.
Okay.
Oh, gosh.
Section 8 housing is through the Department of Housing and Urban Development.
I see.
Yeah.
I live in the San Francisco Bay Area, probably one of the most expensive, or I think the most expensive area in the nation. And I think about how much you would receive on, disability benefits or Social Security, and I don't even know if it would cover a grocery bill. I don't know. It just seems like completely different spectrum of how much you'd get for housing versus food and that kind of thing. I have seen disability housing in my area, like in the next town over, but it seems like most of the people are in wheelchairs.
Right.
Is that like only for wheelchair bound people, or
It should be.
Okay.
It shouldn't be, but I
I'd
don't
have
know
to
without knowing the place. But usually accessible housing doesn't mean you have to be in a wheelchair.
Right.
Um, and this again might be a good time for your daughter to have a reevaluation, to have some documentation of restrictions, whether they're pain restrictions or the spinal cord restrictions, like you had mentioned, endurance, like to get some documentation about that.
So are you talking about like those Med Alert cards or bracelets that you had back in the days? Is that something you're talking about that we should get for ourselves so we can actually prove that we have these ailments? Or what are you saying?
No, I'm saying you should go to your physician and ask for reevaluations in PT, OT, and speech, just so there's some documentation about what your impairments are. Because some people could look really, really good and they're not in a wheelchair, but they still have physical restrictions, whether it be endurance, range of motion, strength, and it should be documented somewhere, or to make sure your physician has that documented in their report. So in the future, if you're trying to get accessible housing, or housing that's reduced for people with disabilities, there's good documentation that's current that you have functional disabilities. Does that make sense?
That does make a lot of sense, because even for me, you look at me and you can't tell that I have disabilities, but my left
Right.
side of my body is killing me all the time. I'm stiff all the time. Focus is a major problem for me. if I'm just on cue with this conversation, I'm good. But if you guys go into 10 different places, you're on your own. So a lot of times I can't even explain that to a physician. But you're telling me that I should just say these things that they could write it down and document it so I could have it on record. So that's something
Yeah, and I mean, when's the last time you had an evaluation from a speech therapist?
Since I left the hospital 3 years ago.
Yeah. I mean, if it were me, I would ask for orders for OT, occupational therapy and speech therapy, physical therapy, evaluation and treat. And I would go somewhere and I would complete an evaluation and I would get their feedback about what strategies might they recommend for you to not have whatever it is that you have.
Michele, did you do that, or did you just stop doing that when you brought your daughter home, or do you constantly get those evaluations for your daughter?
No, but we're going to. She
Yeah.
actually has a doctor's appointment on next Friday, and guess what? Mama's got her list of all the stuff she needs.
Right. And it's, and it's not something that you need to have done every 6 months or even every year. But Michele, in your case, your daughter's getting ready to embrace on a whole new set of goals. And Greg, 3 years, you had to have changed. So I would be, if I were Greg, I would be telling my doctor, the last time I had any therapy and exercises to do at home was 3 years ago, and I've really changed. And I'm still finding attention is getting in my way.
Mm-hmm.
So I want to have these evaluations. And, hopefully both of you would have good therapists that would tell you when you discharge from them when to come back. I mean, that would be my question. So you get an order, you go into speech therapy, for example, and the speech therapist's like, okay, I'm going to be discharging you July 1st, and July 1st comes up. And I would want to know from that speech therapist, what should I continue to work on at home? And when those things become real easy for me, is that when it's time for me to come back for another evaluation? Or do you want to see me back in a year, back in 6 months? I would get some direction from them on that.
I think what's happening with us in this community out here is that we need a person like you in our little pocket so we could pull you out anytime we have these situations. Because once we go to these places, a lot of these medical physicians and things of that nature don't, like my PCP didn't have a clue what to do with me. When I went to him, I'm like, hey, I'm a stroke survivor, da 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 da. Okay, when's the last time you saw your neurologist? I'm like, when am I supposed to go? I don't know. I had a peg tube and I'm like, how do I get this peg tube out? I don't know. all this stuff that, they just, and especially with the problem I was having, I was on a lower tier of having insurance. I was on Medicaid. So I was getting the worst type of doctors I could possibly get. And they didn't have any clue for a man of my age, 40 something years old, to be dealing with a stroke. So a lot of stuff was getting missed. Unfortunately, one time I went to the hospital. I went to my PCP and my blood sugar was out the roof. I was just constantly peeing all the time. And he didn't check my blood sugar. My mother told him, say, hey, prick his finger. Something's wrong with it, because she worked with in the hospital. So she understood something was wrong with me. But he never even thought about it. So a lot of these things go by the wayside because we don't have the proper education, the proper knowledge of actually asking those actual questions, because they looking at us like, what do you want to do? And that's where we like.
Yeah. And my suggestion for that would be start with a physiatrist. It's a doctor of physical medicine and rehabilitation. So when I say it, people always want to say psychiatrist. It's not psychiatrist, it's physiatrist, PHYSIATRIST, but a physiatrist. Their training is managing people's rehabilitation needs after an event, whether it's, a neurological event or, burn or whatever. So they do that. That's their job. A neurologist is another option, but I think you're going to find that your physiatrists are going to be the most trained as to what the rehab process looks like and what the resources are. So that might be a better way to start. And that would be specific to the stroke management or the spinal cord injury management. I mean, the diabetes, your primary care physician should be able to check your blood sugar. I mean, they should be able to manage that. You shouldn't need a specialist for that. But
he had no clue.
yeah, and that's unfortunate. Yeah.
But that's what we're faced out here. Like
Yeah.
they know that there is something seriously wrong with us and we need a lot of medical attention, but they're not really trained on it, especially the people that are with lower or no insurance. It's really bad out here. So that's why I was asking, you know, are there people that actually do things pro bono as a case manager? Because right now you're giving me in the last 35 minutes so much information that if I had 3 years ago, I'd probably be a totally different person right now. You know what I mean?
Yeah, you know, it's real disheartening to me too when I get people that are 5, 6, 7 years post and have never had therapy.
Right.
And you tend to see that more with the people who are walking and talking and look good. You know, the whole cognitive piece of their recovery is not looked at, and then all other kinds of things happen. But I mean, I see it, and you know, I see strokes as young as 21. You know, you end up seeing it all, but I would look at what is the premier rehab center in the area you live.
Okay.
And then I would see, how do I schedule an appointment with a physician connected with that facility?
Okay.
And so if you're here in Atlanta, you know, you have choices. I mean, you have Shepherd Center, but you also, you know, you have Emory, North Fulton does a lot. You know, there's a Piedmont. You have choices here that have good providers, and then scheduling as a new patient appointment with a physiatrist who can help direct some of this.
Okay. Okay. So I'm gonna ask you this question, and I'm gonna have Michele go back on it with you. But as your recommendation, do you think everybody that has some type of disability should have a go-to case manager for the rest of their lives, or is it just?
No, I mean, I don't think they need somebody for the rest of their lives. What I do think people benefit from is a good advocate and a good support system. And that advocate could be a family member. I mean, we just see when we look at outcome data, and we've been doing this long enough to get some good outcome data. People that do best are the ones that have like a caregiver or an advocate, which is usually a family member.
Mhm.
You know, case management, I feel you really just need a consultation with when things change. So that's my personal experience. People are on a pathway and then something changes. They have different goals, or they've lost a job, or somebody has passed away and it changes their situation. And that's when you need to kind of consult with a case manager. So not necessarily with you the whole time, but just in intervals.
So I'm asking that because I know for me and Michele, we have two different type of outlooks, I think, because she's looking for her daughter, not necessarily for herself. And
Right.
I see with Michele right now that is a lot of worry and concern on her because there's going to be that transition of her daughter. So is it more advantageous for her to actually have somebody with her to go through this actual line of transition, to hold her hand from, I guess, when she was taking her daughter out of the hospital till, I guess, when her daughter is completely on her own? Because I could see the anxiety on her face.
Yeah. I mean, I think everybody needs support. Yeah.
Yeah.
You know, I mean, it certainly doesn't hurt, but I mean, for Michelle's daughter, it's imperative that the mom's there. And then that gets into a whole other subject about caregiver support, which is another area that is really lacking. but it's out there.
Yes.
You know, it's out there. You have to find it. And again, if you go to your state's website, association, so either Brain Injury Association or Spinal Cord Injury Association, or even the Center for Independent Living, if you go to those different associations, they often will list support groups. And that can be for caregivers, also for the clients, but for the caregivers. And that can be a really good resource for people to problem solve with their peers, other resources and areas for support.
Well, we're at the 40-minute mark. So at this time, I allow you guys to ask any final questions, and I ask my audience to ask if any questions they have. So Michele, do you have anything else for Kathie that you'd like to ask her?
No, I think she did a great job in giving me so much insight. One thing I would add that really helped me was connecting online with other people suffering from whatever, if it was a brain injury, spinal cord injury. I mean, that's how we met, was through connecting with community. And when you do have a rare disease, you're not going to meet people down the street that have an AVM. I mean, you might, but you probably are. And so to be able to get like, I know I belong to a lot of Facebook groups for AVMs, both spinal and just general AVMs, and I've gotten so much information.
Right.
And being able to connect with people and compare notes has been invaluable.
Cool.
Yes, and that's exactly what a support group should be doing. You know what, and you bring up a good point, Michele, that you know, they're online too, especially with the pandemic. So, you know, a lot of these groups that we're meeting in person are no longer doing that. They've all gone to virtual meetings. So, you know, I would search.
Kathie, do you have anything you want to leave with us before we get off?
No, just, you know, I'm in the state of Georgia, so feel free to reach out to me if you're needing.
I'm going to reach out to you.
Yeah, if you're needing to tap into resources. I can't tell you how many people call. You know, they call all the time. Some I've met, some I haven't met, and you know, anybody at Shepherd, they're gonna try. Anybody that's a social worker or a case manager, I would think would spend time with anybody. I would hope. You know, I think the problem is connecting to that case manager, which hopefully your physicians can help you with.
Michele, did you see how she just plugged in the name of the show, Connecting the Dots? Love it. I love it.
Good.
Okay, audience member, do you have any questions for any of our panelists? Okay, I only see Michele nodding her head no. I can't tell if Kenya or Dolores or Kyra has anything to say, but they don't. That's fine. But I thank everybody for coming out today. This is Stroke Awareness Month of May 2021. This is called Connecting the Dots. We had 8 episodes. Please go back on YouTube and watch each and every one of them. They have very, very important information for speech therapy, vocational therapy, massage therapy, case managers, things of that nature. So whenever you need that information, please go and seek help. Like Michele said, you could go online. There's a lot of groups out there on social media. Could talk to any one of your state-funded programs that could help you out to get you through that hurdle. You don't have to do this by yourself. Thank you guys so much for participating in this. Thank you, ladies, for giving me your time. I really appreciate it. Love you guys. Talk to you guys later. AVM Superhero out.
Bye now. Bye.
Bye.